Assalamu alaikum. This is RT Mohammed Alhendi, and inshallah today I will talk about the AC and CMV mode. First of all, let's recognize what the word control means. Control mode means it means the ventilator controls the patient's respiratory system or respiratory breaths. In another way, the ventilator delivers a preset tidal volume at a set time interval time triggered frequency. It is time triggered frequency. The ventilator does all the work for the patient. In the control mode, a patient cannot change the ventilator frequency or breathe spontaneously because it is a control mode and the ventilator does all the work and the patient will be on heavy sedation. So the ventilator would do all the work for him or her. What is CMV? It is known as continuous mandatory ventilation or a control mode, as I said before. It delivers a preset tidal volume at a time trigger. Uh, time trigger. Uh, Time trigger meaning it doesn't have any patient trigger. It all by ventilator. As we can see over here, it is time triggered. There is no patient triggering, so it's all by the ventilator. The ventilator controls both patients' tidal volume and frequency. The ventilator controls the patient's minute volume. In the control mode, the patient cannot change the ventilator frequency or breath. The patient is on heavy sedation. The patient have zero control on the breaths. Why should we only use CMV? The control mode should only be used when the patient is properly medicated with a combination of sedatives, respiratory depressants, and neuromuscular blockers. So the patient must be sedated. What's the indications for control mode? Basically, uh, as I said before, any patient who is sedated or on heavy sedative. Uh, the control mode with sedation and neuromuscular block is sometimes indicated if the patient fights the ventilator. Fighting the ventilator means the patient is severely distressed. He's having hypoxia and pain and struggling to take a breath, and that's why sometimes we need to sedate the patients, and sometimes we need to just change the mode or the parameter. Other indications for CMV, tetanus or seizures activities that interrupt the delivery of mechanical ventilator, patients on complete risk for a period of 24 hours, also patient with crushed chest injury in which spontaneous respiratory effort produce significant paradoxical chest wall movement. That's why we need the control mode. Uh, Characteristics of control a continuous mandatory ventilation. Uh, we all know that every mode has its own characteristics, and it in all modes it differs in than the other. So we have the type of breath, triggering, and cycling. In continuous mandatory ventilation or CMV, the type of breath is given by mechanical tidal volume, and the triggering is time triggered by the ventilator. Cycling mechanism inspiration is terminated by the delivery of a preset tidal volume. As we look here, there is no patient trigger, there is nothing the patient can take control in. Uh, is there any possible complications of CMV? Well, yes, there are two main complications of this mode. Uh, The first one is apnea or hypoxia. Apnea occurs of if the ventilator uh, has electrical failure. Since the patient is totally dependent on the ventilator for oxygenation and ventilation, the hazard associated with this mode is apnea and hypoxia. If the patient accidentally disconnected from the ventilator should stop to operate because mechanical or electrical failure, as I said. The other physiologic problem is the diaphragm muscle atrophy. This atrophy occurs by heavy sedations. The diaphragm will be inactive, and because of this inactivity, it will lead to an atrophy. Okay, so now we have finished the CMV mode. Just to let you know, CMV mode isn't used right now. All ventilators mostly use assist control mode, uh, or they use CMV by the name of assist control mode. Uh, with the assist control mode, the patient can increase the frequency uh, in the preset mechanical frequency. What does this mean? If we have a respiratory rate at 10 or 12, uh, the patient can take breaths over this 12 respiratory rate. And each controlled breath uh, will give the patient a preset ventilator delivered tidal volume, same as CMV. And if the patient triggers, each assist breath also will result in the same ventilatory tidal volume. Like if the patient does a triggering, the ventilator will give him or give her the same preset tidal volume that set by the RT. We must recognize that the patients can trigger, not like the CMV mode. CMV mode, the patient cannot trigger, and there is no active muscles during using this mode. Uh, can the patient take spontaneous breaths in AC mode? Well, no, but the patient can trigger. Uh, the patient cannot take any spontaneous breaths. It just allows the patient to trigger. The mandatory mechanical ventilation, the mechanical breaths, may be either by patient trigger or patient spontaneous inspiratory effort assist, or time triggered by preset frequency. As we look at this figure, we will see here the patient trigger the ventilator, and the ventilator will give him a preset tidal volume at preset pressure, sorry, at settings. The same settings you put, the ventilator will give him. As you can see, patient here triggers and the ventilator give the patient. Here, patient does not trigger. Also, the ventilator will give him the same amount of pressure that gave him before. How cycling occurs in AC mode. Inspiration in the AC mode is terminated by volume cycling. When the preset tidal volume is delivered, the ventilator cycle is cycled to expiration. Indication of the AC mode. Uh, Simply, the AC mode is most often used to patients who have full ventilatory support for patients to used to provide full ventilatory support for patients who are first placed on mechanical ventilator. I know some RTs they put the patients on the AC mode as the initial setting, volume control AC mode. Uh, the AC mode is typically used for patients who have stable respiratory drive, a stable spontaneous frequency from 10 to 12. Why we need this? So we need the patient to trigger the ventilator to inspiration. That's why we need a good or stable respiratory drive. Uh, the AC characteristics in breath, as I said in the CMV mode, they all have type of breath, triggering, and cycling. The type of breath here, in each breath, it's either assist or control. It delivers a preset mechanical tidal volume. If the patient trigger or the time trigger, it will give the patient a preset mechanical tidal volume. The triggering mechanism, it's be either by the patient assisted or the ventilator time trigger. The cycling mechanism is terminated either by delivery a preset tidal volume or by high pressure limit. Advantages of the AC mode. First, the patient's work of breathing requirement in AC mode is very small when triggering sensitivity is set appropriately. Uh, we need to know the appropriate triggering sensitivity for this patient or any patient. So the work of breathing will be very small, and the ventilator will give the patient inspirative flow that meets or exceed the patient's demand. The second advantage of the AC that the patient has appropriate ventilatory drive. The patient can control the minute volume required to normalize the CO2. The patient can control the frequency, can take frequency above the set frequency that be given by the RT. Uh, and also, the AC mode allows the patient to control as I said before, the AC mode allowed to control the patient to control frequency and minute volume required to normalize patient's PaCO2. Sorry. Complications for AC mode. The potential hazard complications associated with AC is alveolar hyperventilation, respiratory alkalosis. Include that beside that hazard, there are other hazards because we are using a volume. It's volume cycle mode, so the pressures it's vary during the breaths. If it's not directly controlled, which may cause body trauma, and the patients can develop hyperventilation with breath stacking, auto beep, and respiratory alkalosis. Thank you.